think I should give an update with regards to my health or cancer or what have you. Okay, so actually, what really happened is first I spoke to hematologist, Dr. Kendall, and she's the one that told me that I have CML or chronic myeloid leukemia. Um, and she basically told me I have cancer and sugarcoated it. She told me that now we have found the answer as to why you have all this joint pain. Basically pain from head to toe. Like right now I'm having it in my chest, and if I use my fingers, it'll be in my fingers. Uh, so she said that now we have an explanation for your joint pain. So even though I had an appointment with a rheumatologist, I they canceled it because they already found an answer. And she said if you take the medication for CML, uh, you'll feel a lot better. So I was attributing all my suffering to CML. And then after that, I was referred to Dr. Liu, who specializes in hematology oncology. That means blood cancer, right? So she tried to do a bone marrow biopsy once. It didn't work, and she referred me to a bunch of radiologists that did it on a CT scanner, and it worked. And I was confirmed to have chronic phase of CML, and so this is what yesterday I went to see her for the first time after uh, the bone marrow biopsy, and she what she said was kind of like I was speechless and I was really depressed and upset. So I'm gonna go sit with chocolates, and then I'll be back. So yesterday we went to see Dr. Liu, and she pretty much said that okay, I have CML and it's in a chronic phase, and there's a medication that I can take. I think Imatinib or something like that. It's a they call it a TKI. So basically, what she said is that okay, this medication, the benefit is that it will give you a lifespan that's comparable to the general population. In other words, I will be able to live about 40 to 50 years more in the future. And so basically to prolong my life. And I said, okay. And then she goes on, okay, now the side effects. And she goes on and lists all of them. And I'm like, she actually did this over the phone once already. But this is again in person. I says, doctor, can you stop scaring and stuff like that? It's probably not because of CML. It's probably something else. Because by then I was already asking, I do not want to prolong my life and suffer. I want it to, and I mean, I'm done suffering here. And like, I would like medical aid in dying, medical assistance in dying. Sorry, I was just say aid, I don't know. It's assistance, medical assistance in dying. Or in my case, I want euthanasia. That means a physician would administer drugs so that I would die. Or nurse practitioner, but whatever. So, yeah, so I'm like, I want medical aid in dying. And she's like, oh, well, I don't know what to do. I don't think you qualify for CML. I said, well, the laws changed last week that you're suffering. It doesn't mean that your life has to end soon. The reasonably foreseeable death has been removed from the laws. And she's like, okay, I'll just refer you to palliative care. And I'm like, whoa, palliative care is like for people dying and like in agony already. And I'm like, so that's what happened. I said, so this medication you take, it prolongs your life. It may not take away the pain because she thinks, Dr. Leo thinks, that the pain is not because of the CML, like Dr. Kendall said. So she said that I should be going to a rheumatologist, just like Carrie Fulton suggested, and they talked. She talked to Carrie Fulton that I should go to a rheumatologist. After Dr. Kendall canceled my appointment with the rheumatologist, so I'm like to find out what's the matter, why am I in pain, and all that stuff. So, and I'm like, and I don't know. So it's like, okay, you take this medication, it prolongs your life, that's all. But I'm still gonna be suffering the way I am. Why? We don't know. Could be CML, could be XYZ, who knows what it is, right? But I will continue to suffer. If I do not take this medication for CML, it will become acute leukemia that is very hard to fight, and that pretty much will die. So I have like about 5 years, and then I die. And forget about them giving any medication to deal with this so-called horrible death that's been happening. So I've decided to take the medication. Okay, fine. So I called my pharmacist, and my pharmacist said the doctor ordered the medication and stuff like that. Then after I'm feeling all bad, that evening, the St. Mike's Hospital pharmacist called, and the pharmacist said, Dr. Lee wanted me to talk to you. I said, okay. So she goes into this medication again. I think Imatinib or something like that. So it's called a tyrosine something. Oh my God, what is it? TKIK? I can't remember what it stands for. Whatever. So, and says that this medication will give you a normal lifespan, but it will not take away all the pain or whatever you're suffering from. And here's the side effect. And she's listing things that I already have. Like she said, oh, it's gonna cause you to have diarrhea. Well, I'm aware you're suffering from diarrhea. She said, oh, then it's gonna become just worse. And then you're gonna suffer from this. You're gonna suffer from that. You're gonna suffer from this and that. This is the side effects here. And I'm like, I'm already suffering from that. So you're gonna say, they said, well, what I mean is gonna get worse. And I'm sitting there. I said, are these people just completely crazy or what? Just because it's a Catholic hospital, and St. Mike's is a Catholic hospital, and they don't have medical aid in dying. I mean, they say they know how to refer you to other hospitals that deal with people who want medical aid in dying, but I feel like they're not. I feel like they should just hand me over to the University Health network hospitals, right? Toronto General, Princess Margaret, Toronto Western, and those hospitals, like hand over my care to them because they know how to deal with medical aid in dying or medical assistance in dying. So right now, I really don't care what you want to call it. Why I'm like this? Is it CML, like the Kendall said, or if it's some mysterious thing that some rheumatologists will find, probably fibromyalgia? It doesn't matter what. The laws have changed now. Canadian doctors and Canadians embrace the laws. I know that Canadians don't have a lot of nice laws, woohoo, but when you come here, it's not really, it's like that, you know. And I do feel pressure to take this medication. It's like, if I don't take it, they're gonna see me as suicidal. Then they're gonna, like, you know, or say that, oh, you're mentally ill and not able to make medical decisions or take care of yourself or whatever. And they're just gonna coerce me. They apprehend me under mental health act, coerce me to take the medication and whatnot. I mean, you think I don't have had doctors threaten to coerce me to get medical treatment or diagnostic tests. Dr. Mapara from the United States in Windsor said that dollars is coerce and that's it. Like we la la and that. So that's what's going on, and that's why I'm kind of pissed off because I want medical aid and dying, and these people were they're trying to like I don't know. First